The FDA has formally issued a drug safety communication dated May 16, 2025, warning of a rare but potentially severe itching, known as pruritus, that may occur within a few days after stopping long-term use of cetirizine, Zyrtec, or levocetirizine, Xyzal, including both prescription and over-the-counter forms. Cite Turn Search 2. Key facts about the FDA warning. Scope of reported cases. FDA identified 209 cases worldwide between April 25, 2017 and July 6, 2023, including 180 associated with cetirizine, 27 with levocetirizine, and 2 with both drugs. Of these, 197 occurred in the U.S. Cite Turn Search 4. Turn Search. The FDA has formally issued a drug safety communication dated May 16, 2025, warning of a rare but potentially severe itching, known as pruritus, that may occur within a few days after stopping long-term use of cetirizine, Zyrtec, or levocetirizine, Xyzal, including both prescription and over-the-counter forms. Cite Turn Search 2. Key facts about the FDA warning. Scope of reported cases. FDA identified 209 cases worldwide between April 25, 2017 and July 6, 2023, including 180 associated with cetirizine, 27 with levocetirizine, and 2 with both drugs. Of these, 197 occurred in the U.S. Cite Turn Search 4. Turn Search 8 on. Typical patient use. Most patients had used the medication daily for several months or even years. In some instances, itching occurred after use of just over 1 month. Cite Turn Search 5. Onset and timing. Pruritus generally began around 2 days after discontinuation, ranged 1 to 5 days, and was widespread, sometimes affecting ability to work, sleep, or function normally. Few cases led to serious outcomes, including hospitalization or severe impairment. PATES. Turn Search 5. Resumption and tapering. In most cases, restarting the antihistamine resolved symptoms. In cases where the medication was later tapered off gradually, 38%, 924, experienced resolution via that strategy. Cite Turn Search 4. Turn Search 5. What this means for patients and providers. For patients, if you plan to stop long-term use of cetirizine or levocetirizine, discuss a tapering strategy with your healthcare provider rather than an abrupt cessation. Report any severe, new-onset itching shortly after stopping the medication. In many cases, resuming the medication may alleviate symptoms. Recognize that this reaction is very rare relative to the millions of users. For instance, over 60 million OTC packages were sold in 2022 alone. Cite Turn News Turn Search 7. For healthcare professionals, include a new warning about the risk of pruritus after discontinuation in the prescribing information, and inform patients using OTC formulations to expect updated drug facts labels. Cite Turn Search 2. Inform patients of the timing, a few days post-stop, and risk factors, duration of use. Advise patients that symptoms may improve when restarting and consider a slow taper off if discontinuation is desired. Cite Turn 3. Encourage reporting of suspected cases to the FDA MedWatch program. Summary, table. Reported pruritus cases. Typical use. Onset after stop. After stop, management. Cetirizine, 100 tech, 180, usually 3 months, median 24 months, 42 days, 1 to 5, restart, taper to discontinue. Levocetirizine, 27, similar, same approach, both drugs, 2. Bottom line, the FDA does not recommend stopping cetirizine or levocetirizine abruptly after long-term use. There is a new mandated warning on both prescription and OTC forms as of May 16, 2025. Patients and providers should be aware of the risk, the timing, and the safe discontinuation strategy. If you have health concerns or are planning to stop one of these medications, consult a healthcare provider for personalized guidance. Disclaimer: this information is educational and not a substitute for professional medical advice.